Very often, degenerative disc disease is hereditary. It runs in families. Often my patients have a brother, sister, parent with degenerative disc disease. I usually tell those patients, hey, blame your mom or dad who's got the bad back, because that's why you have a bad back. So it's very common to run in families. I see people who genetically have amazing looking discs and have one little bulge, and then I see other people that have degenerative disc disease starting in their 20s, even sometimes teenagers. So it is a strong hereditary influence. If you have a really strong hereditary influence and you're starting to get back pain, it might be best to consider getting an MRI early, just to take a look to see, is there something going on now so that you can be preventative for the future to keep you away from having surgery and other modalities that are more invasive.